Hello and welcome to a joint event sponsored by Rochester Lifestyle Medicine Institute and Plant-Based Nutrition Support Group. And I'm going to give another minute or so for people to roll in. It looks like a lot of people are rolling in. We have a lot of people registered for tonight. So one more time, I am Dr. Ted Barnett, founder and president of Rochester Lifestyle Medicine Institute. Some people know me as Dr. Veggie or the high-tech doctor with low-tech solutions. And I'm very excited to be able to welcome you all to an exciting event that's co-hosted with Rochester Lifestyle Medicine Institute and the Plant-Based Nutrition Support Group. And tonight, our presenter will be Dr. Alan Goldhamer, and the title of the presentation is How to Use Diet and Fasting to Delay Death and Debility. And now I'd like to tell you a little bit about our illustrious guest speaker. Dr. Alan Goldhamer is a leading expert on medically supervised water-only fasting. He founded and became the director of TrueNorth Health Center in Santa Rosa, California in 1984. TrueNorth Health is a multidiscipline practice that includes doctors of medicine, osteopathy, chiropractic, naturopathy, and psychology. Its healthcare providers treat patients with conditions ranging from high blood pressure and diabetes to autoimmune disorders and lymphoma. The center is the largest facility in the world specializing in medically supervised water-only fasting. TrueNorth Health utilizes a nutritional medicine approach based on an exclusively whole food, plant-based diet free of added salt, oil, and sugar. The center is affiliated with the TrueNorth Health Foundation, whose mission is to expand evidence-based knowledge of how medically supervised water-only fasting and diet impact human health. They train clinicians in the use of these interventions and share their findings with researchers and the public. Dr. Goldhamer is the author of the Health Promoting Cookbook and co-author of one of my favorite books, The Pleasure Trap, Mastering the Hidden Force That Undermines Health and Happiness. We quote that book all the time. He is also the principal author of 2 landmark studies that showed evidence of the benefits of water-only fasting, as well as numerous case reports published in peer-reviewed index journals evaluating the effects of water-only fasting in the treatment of a variety of conditions. Again, our talk tonight is how to use diet and fasting to delay death and debility. Dr. Goldhamer has appeared just on time. Thank you so much. And I'm going to stop sharing and let you share. So welcome, Dr. Goldhamer.
Well, it's my pleasure. I'm glad to be here.
Oh, it's so exciting to have you.
So I think the main problem right now that we have to address is that 3/4 of our population are actually overweight or obese. And as a consequence of this dietary excess that leads to obesity, we have an epidemic of cardiovascular disease, diabetes, autoimmune disorders, and as well as cancer. The reason why people are overweight is because we overconsume calories and we get fat, and we particularly get visceral fat. And visceral fat is associated with the production of inflammatory markers that are thought to be causal in these diseases. We eat highly processed foods that contain chemicals that artificially stimulate dopamine production in the brain. And dopamine is that neurochemical that's associated with pleasure. We call this pleasure trap, the dietary pleasure trap. And the chemicals that people are eating that fool the satiety mechanisms include sugar, oil, and salt. So it's our contention that sugar, oil, and salt are not actually food, but hyperconcentrated byproducts of food that are added to food in order to stimulate dopamine and make the food good. And it leads to a cascading problem, that the world is dealing with. That being, people are essentially addicted to the artificial stimulation of dopamine in the brain because of how we moderate our feed. And we call it the pleasure trap, and that's the premise of our book. We believe it's the hidden force that underlines health and happiness. It's interesting that 93% of all the calories that are consumed by people in industrialized countries comes from either animal food, so meat, fish, fowl, eggs, and dairy products, or these highly processed food byproducts, the sugar, the oil, the salt. And only 7% of calories currently are derived from fruits and vegetables. And actually, 1/3 of that is potatoes. And they're served mostly as French fries and potato chips. The fact is that fruits and vegetables don't even make a statistical to the calories of many of the people living in industrialized countries. They're the decoration on the plate. This is what food would have looked like for most of our ancestral history. And this is what food often looks like today. And I would challenge each of you to look really carefully and see whether or not you can tell the difference. Because if you can tell the difference between our ancestral food and modern food, you understand now why people are fat, sick, and miserable. So what's the solution? The solution to this problem is to eat an exclusively whole plant food diet that's free of added salt, oil, and sugar. So essentially, you could describe it as a vegan, SOS-free diet. In addition, there are some things that we recommend that seem to help people avoid dietary excess, including limiting the feeding window. We recommend for people trying to maintain or lose weight 8 hours a day. And that would essentially mean don't eat 3 to 4 hours before you go to sleep at night. And if possible, delay breakfast in the morning till you can do some exercise, and that seems to facilitate maximum fat burning and weight. So a health-promoting diet from our viewpoint would include fresh fruits and vegetables, whole grains, beans, nuts, and seeds. Whole plant food, SOS-free diet. But what happens if you're caught in the dietary pleasure trap and you're having trouble freeing yourself from those addictions, whether it's to things like coffee or highly processed foods? What could somebody do to make that transition easier? Well, one option is this idea of fasting. Fasting has become more talked about in the media, more popular, particularly intermittent fasting, this type of, narrow feeding window or short-term intervention. There's also longer-term fasting that we use at TrueNorth Health Center, which is medically supervised water-only fasting, where there's the complete absence of all substances except water in an environment of complete rest. Now, the longer-term water-only fasting is not for everybody. To determine if a person would be a candidate for water-only fasting, you would need to review medical history, you'd need a physical examination, and you'd need some baseline laboratory data, not only to rule out contraindications to fasting, but also to have baseline data so you can then tell the difference during fasting, whether some symptoms that are generated are positive attempts of the body to heal itself or deteriorative problems that require intervention. It's not surprising that the conditions that are most favorable to fasting are the very conditions that are caused or associated with dietary excess. So obesity, visceral fat, elevated blood lipid levels, high blood pressure, type 2 diabetes, lymphoma, GI disturbances, disturbances in the microbiome, autoimmune diseases, and dependence and toxicity. It's interesting that patients that are addicted to, say, nicotine that go on a fast after 2 or 3 days will often experience no withdrawal symptoms. Some people, of course, say it's probably because they're so miserable fasting they don't think about it. The truth is that the whole physiological processes are facilitated, making it much more efficient. Some people shouldn't be doing long-term fasting. Some of the obvious relative contraindications include pregnancy and lactation. If you try to do extended fasting when you're lactating, you will lose your milk production. The condition anorexia nervosa, which is actually a neurological condition, is a relative contraindication to fasting, as is type 1 diabetes. If you destroy the islets of Langerhans in your pancreas and you move set up with insulin, you're going to have trouble with water-only fasting because you need insulin to really adapt. Okay, so relative contraindications to fasting include pregnancy, lactation, anorexia nervosa, type 1 diabetes, a recent stroke, myocardial infarction, pulmonary embolism, DVT, cardiac instability, or atrial fibrillation. All of these things are often associated with anticoagulant therapy, which you want to arbitrarily discontinue, and you also don't want to be doing fasting on these or most other medications because they can be potentiated and create a lot of problems. If a person had severe kidney disease, that would be a relative contraindication because your kidneys are your main detoxifying organ during fasting. That's where the blood is purified and the waste products are eliminated in the urine. Genetic defects like porphyria or MCAD, medium chain, acetocoenzyme A dehydrogenase deficiency would also be a contraindication to fasting. You wouldn't be able to break down fatty acids, and that would become a significant problem early on. If a person is in a deficient, depleted, or cachexic state, where they're unable to safely discontinue medications, then water fasting wouldn't necessarily be recommended. And also, it's critical if you're going to do a fast that you, this is not necessarily intuitive, because people think, well, if they're active, wouldn't they lose more weight? And you would, but the weight you'd lose would not be more fat, it would be in fact lean tissue. When you're fasting, once you've depleted your glycogen stores, the only place the body can get glucose is, of course, from gluconeogenesis and breakdown of protein, which is why you want to rest during fasting so you don't increase the need for glucose. In fact, even the brain itself, our main burner of glucose, converts to burning primarily beta hydroxybutyric acid, a byproduct. So fasting, in our experience, runs anywhere from 2 to 40 days. So it's not just Moses, David, Elijah, and Jesus that fasted for long periods of time, but our patients as well. The average fast lasts from 1 to 3 weeks, and some patients do require multiple fasts in order to resolve problems. So one of the first questions that people would ask about fasting is it actually safe? And in order to answer that question, one would have to do a fasting safety study, and that's exactly what we did. And is fasting safe? A chart review of adverse events during medically supervised water-only fasting was published in 2019 in BMC's Complementary and Alternative Medicine. And in this study, we used the common terminology criteria of adverse events in the American Cancer Society. So all the patients were evaluated for all their symptoms every day. And they were given a grading of 1, 2, 3, 4, 5 for each symptom. Most obvious symptom is death. That would be a grade 5. That would be, you wouldn't miss any of those. Grade 4 are symptoms that have significant potential effect if not dealt with. Grade 3 are considered medically significant, life-threatening. Grade 2, moderate, and grade 1 are mild symptoms. And so we evaluated every patient every day for a period of 5 years, then went medically supervised fasting. There were 5,949 adverse events on those patients. But as you can see, most of them were category 1 and category 2 events, which are things you'd expect to occur during fasting, so low back pain, skin rashes, and nausea, etc. There were 310 category 3 events. These are considered more medically significant. Most of these were hypertensive events. Any day a blood pressure is above 160, according to these criteria, it is considered an adverse event. There was only one category 4 event. This was a hyponatremic event where blood sodium levels dropped below acceptable levels. This did not amount to any problem because you just terminate the fast and the sodium levels, of course, come back up. But the idea of categorizing it as a category 4 event is if you didn't recognize it, if you weren't monitoring it, it could have been significant. There was no deaths. So the point was, of the 310 category 3 events that were hypertensive crisis, it turns out that if a patient comes into the center and their blood pressure is 220 over 120, and they're capped out on 5 medications, and the next day they're 200, the next day they're 190, the next day they're 180, then 170. Each of those is still considered an adverse event because it's an arbitrary standard. Anytime blood pressure is 160 or above. So even though you have a clear trend of positive response, it still gets registered as an adverse event. In fact, 95% of those grade 3 events are exactly that, hypertensive patients that are in the process of resolving their hypertension. So the conclusion of this safety study was that the majority of adverse events are mild to moderate. Most events are ones that are expected to occur during fasting. There's little correlation between age and fasting, and this was really important because up until this study, no human subjects committee would approve fasting for subjects over 65 because they were considered too old and had been untested. In this study, it was clear that whether you were 65 or 75, it didn't make any substantive difference in terms of your risk profile. So now any IRB that utilizes this protocol could justify fasting patients, including those that are over. The conclusion was that the water-only fasting, following the protocols that we use at the TrueNorth Health Center, is in fact safe. We did a study, published a study with our colleagues at the Mayo Clinic. This was water-only fasting in the treatment of stage 1 and stage 2 hypertension. And we used the same CATE criteria to evaluate not only effectiveness, but also safety. In this particular study, 30 participants were involved that ranged from age 30 to 75. They had systolic blood pressures of 130 to 180 and diastolics of 80 to 120. They fasted for greater than 7 days, underwent controlled refeeding, and we found that average fasting length was 11 days. It ranged from 7 to 40 days, and refeeding is as listed here on the chart, 3 to 17 days. And again, use the same CTCAE criteria to evaluate safety. And what we found was consistent with the previous safety studies. There were 315 adverse events that were grade 1, 44 grade 2, 9 grade 3, and no category 4 or category 5 events. And interestingly enough, the highest grade, this lists the highest grade adverse event. And as you can see, again, no grade 4 or 5. On the grade 3, they were all hypertensive events. And of course, this was a study evaluating the effect of fasting on high blood pressure. None of those elevations above 160 lasted for more than 1 day. The one participant had a low white count. It's interesting when you look at white counts in fasting, there's a significant increased autophagy during fasting. And so what happens is the non-functional white cells are cleared out very rapidly, which lowers the total count. It doesn't reduce immune system function because those cells are not particularly viable in any case. But so the total count will drop, but not immune response. So you can see here that at 6-week follow-up, so we fasted these patients and we brought them back at 6 weeks and evaluated what their success had been with free living. And 26 of the subjects were still normotensive without medication. One patient was on half the dose of medication that we started with. And now what's exciting is we have now 1 year follow-up data from these subjects. And at 1 year, the majority were still able to maintain their weight and their drug-free blood pressure state. So are you able to see what the conclusion slide here?
Yes, we are.
Okay, so as it shows, the majority of patients were in fact able to complete this process, which is significant in of itself because you're asking people to undergo water-only fasting. The majority of the events were as described, and now, as I mentioned, now we have 1 year follow-up data, which is really exciting because there's very little in alternative medicine where they've done long-term follow-ups, and we're finding that people, in fact, are able to sustain these results. So we also did a study, I hope you can see this, on the effects of cardiovascular disease on cardiovascular markers, and we had the advantage of using a DEXA scanner, so we could do whole body composition and really analyze what happened to the body during fasting. People say, well, you go on a fast, you lose weight, and you gain it right back. And what we were able to do is determine, well, what type of tissue are you actually losing, and what type of tissue are you gaining back? And in this study, we had 38 participants ranging from 40 to 70. And we looked at, what happened to their body composition during fasting and also on follow-up. We brought these people back on follow-up. And you can see here that fasting ranged from 13 to 19 days. That refeeding was 5.9 days, but the follow-up was at 45 days. And we noticed that the weight had statistically significant reductions in weight loss, in fat loss. Lean tissue was actually higher at 6-week follow-up than it was before fasting. And effects on bone mineral content was unchanged. So there was no loss in bone mass. Lean tissue got higher, fat got lower. And what was exciting was to look at what happened to visceral fat, because visceral fat's the type of fat that seems to be most associated with pathology. And in fact, visceral fat was preferentially mobilized during one-hour fast. In fact, the ratio of visceral fat to adipose tissue was actually 3-to-1. So it turns out to be the most efficient way of mobilizing visceral fat that's been demonstrated. So the conclusions of this study, which has in fact been published, was clinical markers of cardiovascular disease were all significantly reduced at follow-up. Total cholesterol, LDL, were reduced at follow-up. HOMA-IR, that was actually higher at the end of fasting, was statistically significantly lower at follow-up. And fatty liver index was significantly reduced. And so it does suggest fasting as a viable way of treating fatty liver disease. This is an individual that underwent fasting, just to give you a graphic picture of what these DEXA scans look like after 15 days of fasting. And if you'll notice here, the magenta line represents lean tissue that goes down and then recovers during refeeding. The black line represents fat that goes down and continues to go down through refeeding. So even though people are regaining weight, that is, they're putting a couple pounds of glycogen back in their muscles, they're rehydrating, they're getting fiber, they're gaining protein, the fat loss continues. And just another way of looking at the same data, total body weight loss, total fat loss, total visceral fat loss. Over 50% of the visceral fat on this individual was extinguished within this 2 weeks of fasting. And then lean tissue is lost, but then is recovered to the point where, as I said, at 6 weeks, people had a higher lean mass than they did before replacement. The leading contributing cause of death and disability, one of the major problems that we have today is high blood pressure. It's responsible for congestive heart failure, or at least the majority of it, as well as stroke, major contributing factor of stroke. And 40% of people, think about this, 40% of people over 25 are now hypertensive, and 63% of people over 60. So if you're not hypertensive, you're actually abnormal. High blood pressure is the leading justification for prescription medications, leading justification for visits to physician's office. But the majority of people that actually have heart attacks and strokes don't actually have the high blood pressure high enough to justify the risk of medication. You can't give everybody blood pressure medications because they would die at a higher rate from the medication than saved by lowering the pressure, unless the blood pressure is high enough so that the blood pressure medications reduction in stroke risk offset the increased risk of dying from the medications. So for example, if your blood pressure is 138/88, you have 5 times the risk of having a heart attack as somebody that has 110/70. But the risk of medications can exceed the benefit unless you have end-organ hypertension. So for every point you drop your blood pressure with diet and lifestyle, that is your systolic blood pressure 1 point, there's a 1 point reduction in all-cause mortality. But that level doesn't stop at 120/80. It goes down probably to as low as 90/60, according to Pito from Cornell. But unfortunately, this is how we treat blood pressure today. We give 1, 2, 3, 4, 5 medications. They do have significant side effects, particularly chronic cough, fatigue, impotence, and death. And one of the downsides of medical treatment for hypertension is that you're told that you'll never get well. You're told you'll be on drugs for the rest of your life, and that that's the best you can do. In our experience, that's not true. In fact, we know from large numbers of studies that weight loss, going on a vegetarian high-fiber diet, not drinking alcohol, exercising, sodium restriction, and combinations of these interventions are highly effective at lowering blood pressure. The most effective way to lower blood pressure, based on a study that we did with T. Colin Campbell from Cornell, is actually fasting. Fasting on water only reduces stage 3 hypertension an average of 60 points, which is the largest effects that have ever been published. This first paper of ours was published in JNPT. It was followed, again, showing a 60-point average drop in stage 3 hypertension and proportional drops in stage 2 and stage 1 hypertension. And was followed by a second study looking at patients that had elevated blood pressure, but not high enough to justify medication. And of course, their blood pressure dropped proportionally. So whether it's serious hypertension, moderate hypertension, or mild hypertension, water-only fasting is a highly effective way of normalizing blood pressure. Now, honestly, you still have to follow it with your diet and lifestyle changes in order to maintain the results. But the fact is, it's more effective at bringing blood pressure down in the normal range than anything else that's been demonstrated. At one point, we were approached by the International Union of Operating Engineers, California's largest, should say, most powerful labor union, and we did present our data to them, and ultimately were approved for coverage. We did a study. We took 30 consecutive patients from the union that have hypertension or diabetes. We fasted on average 3 weeks. They dropped their blood pressure and their weight. As you can see, 26 pounds, 30 over 11. At follow-up, they were still down 28 and 27 over 16. And the union turned out to save more money in the first year than the entire cost of the program. We went on to for over a decade working with this union, treating high blood pressure and diabetes, doing with over 100 of their. So we should look potential mechanisms of fasting, because it is a little bit strange when you think about what we're saying is that doing essentially nothing, fasting intelligently, is more effective at treating the leading contributing cause of death and disability than the pills and potions and powders and all the expensive treatments that have been advocated. How is it possible that fasting could do that? Some possible mechanisms include weight loss. Average patient that undergoes water-only fasting will lose a pound a day. And as we saw from our data with our DEXA scanner study, that weight is going to be predominantly fat and preferentially visceral fat. The body also goes through natriuresis during fasting, where it will selectively mobilize sodium from the body. In fact, this is more powerful than the traditional diuretics and other medications that are used. And you see sometimes anywhere from 2 to 10 pounds a day initially in patients that are significantly overweight just because of this diuretic effect. The bodies of patients are surprisingly toxic. If you do a fat biopsy of a human, you find that there are hundreds of different chemicals accumulated at various concentrations: PCBs, dioxin, pesticide residues, heavy metals. These materials are rapidly mobilized during fasting. In fact, some people have cautioned that the body's so efficient during fasting that perhaps these toxins would do damage to the body, but that's not been our experience. In fact, the body is well situated using this biological adaptation of fasting to mobilize and eliminate those materials accumulated, particularly those accumulated in fat. And it also kicks in enzyme systems which are involved in macro and micronutrient utilization, as well as detoxification. A lot of detoxification is enzymatically driven. Those enzyme systems are reduced during fasting, and it turns out they persist after fasting. So every time people fast, they get better and better at mobilizing macronutrients like fat and protein and glycogen, and also at detoxification. And that may be why intermittent fasting, when you fast every day for 12 to 16 hours, may kick in a little bit of that, and cumulatively, day after day, may have a substantial long-term benefit. And clearly, long-term fasting has a profound effect on inducing these enzyme systems, that we found that they do, in fact, persist and accumulate. So every time people fast, they tend to get more and more efficient and effective at both detoxification as well as macronutrient mobilization, so mobilizing fat, protein, and glycogen. This enzymatic induction of glycogen mobilization, for example, is one of the reasons why athletes become, quote, trained athletes. They get better and better at mobilizing glycogen stores by inducing that process. Insulin is the hormone that drives sugar from the bloodstream into the cells, where it's needed to be a primary fuel. And insulin resistance is reduced by fasting. Insulin resistance is not reduced by medications, but it is induced by fasting. And so it may be why the majority of our type 2 diabetics are able to achieve normal blood sugar without medication, because of this reduction in insulin resistance. And we did show in a previous study that I put up there that the HOMO-IR, although it increases temporarily during fasting, significantly reduces by 6 weeks post-fasting. The gut, as you know, is a tunnel. It goes from the mouth through the intestines and then to the rectum, and eventually there's a hole at the end called the anus. And digestion essentially is shoving stuff in one hole and then trying to push it out the other hole. Nothing gets into the body unless it gets absorbed through the intestinal mucosa, which is a very fine micro mesh, which is designed to filter out everything except essential nutrients. For example, proteins are too large to get through the micro mesh, but amino acids can. It's designed to help filter out bacteria and other situations, and it works really well unless something damages it and the holes get bigger. So essentially gut leakage. Gut intestinal mucosa works very much like a screen does. If the bug is bigger than the hole, the bug doesn't get in, but if the hole becomes bigger, then obviously gut leakage is a possibility. The thing that we believe that makes gut leakage more possible would be inflammatory oxidative damage from free radicals. Smoking cigarettes, drinking alcohol, or eating high-fat foods or foods like that. And one of the things that fasting does is it helps heal and allow for the body to heal this gut leakage. And you can measure that by looking at talk about free radical difference on the face. We call it smoker's face because, you know, wrinkles are nothing more than collagen tissue. You know, this is an example of free radicals here, the smoker's face, where cross-linked collagen tissues from the free radicals from smoking damage the face. Obviously, smoking doesn't just damage the face, it damages the whole body. That's why I like to say that smoking may actually help prevent lung cancer. Because, you know, only 80% of smokers will never get lung cancer. So it might, if you just look at those statistics, it might be, well, maybe smoking is protecting them. And it does actually, because it causes so much animal damage to the lining of the blood vessels that smokers die from cardiovascular disease before they live long enough to grow their tumor. So in that way, it is actually protected. If you could make smoking more dangerous and everybody died from a heart attack, I wonder if they'd allow them to advertise it as cancer safe. Fasting also normalizes the autonomic nervous system. As you know, the autonomic nervous system has two sympathetic and parasympathetic branches that have to balance each other out. When they get out of whack, you have problems. For example, if the sympathetic tone is set too high, you may have constipation. If the parasympathetic tone is set too high, you may have diarrhea. And balancing autonomic nervous tone is the job of literally hundreds of healing systems that we cover, whether it's massage, biofeedback, homeopathy, chiropractic manipulation, osteopathic manipulation, etc. These systems all, at least to some extent, work by helping to rebalance the autonomic nervous system. But the most powerful way of recalibrating autonomic nervous system, in my experience, is fasting. It works like taking a corrupted hard drive, rebooting it. And you don't always know why it's working, but you know, you turn the computer off, you turn it on, and lo and behold, it's working again. And that rebooting effect seems to be analogous to what happens in fasting. It's interesting that every major religion has a tradition of fasting. You know, the Jews, the Jains, the Hindus, the Muslims, the Christians don't agree on a lot of things, but they do agree on one thing, that fasting can be a very helpful tool. The immune system, autophagy is enhanced during fasting. Yoshinori Yoshimi won the Nobel Prize in medicine for his work on autophagy. It turns out autophagy is how the body gets rid of cancer cells and cleans up debris. And it's a process that seems to be profoundly enhanced with fasting, which may be a lot of things that heal up in fasting that don't heal up as efficiently in the fed state. And a lot of chronic infections that seem to have trouble healing oftentimes will heal in fasting. And, you know, one of the most obvious benefits of fasting is taste and rotation. Good foods taste better after fasting. And we've actually done a study where we were able to determine minimum threshold detection of sugar and sweet. We found it, in fact, in this paper that we published, that effects of prolonged water-only fasting followed by a whole plant food diet on salt and sweet taste sensitivity and perceived intensity, food liking, and dietary intake. So we found that not only did people like good food better and like highly salted, highly fatty foods less, but their behavioral changes that follow were supported dietary improvement after fasting. So we believe that part of the reason is because, it helps good foods taste good. So this was the conclusion of the study, that increased salty and sweet sensitivity, decreased liking of sweet, salty, and fatty foods, decreased sugar consumption, and increased fruit and vegetable intake and fiber consumption followed in these patients after fasting. I like to tell this story. This is the very first union patient that was referred to us. It was a gentleman that, when the union made our program a covered benefit, this was the first guy they sent in. He was 220 over 120 blood pressure, capped out on 5 medications. They wouldn't let him run the cranes anymore because he was afraid he was going to, damage the crane and kill himself and others. So they told him to come to us, that we had a program. It was a fully covered benefit. They would do the program and then he could go back to work. The only thing they didn't tell him was what the program was. So this guy shows up thinking he's going to get a 6th medication, and looks around the center a bit and decides that maybe he's in the wrong place. And I assured him he was not in the wrong place. I had his name on the list. He was here to get well. He argued that he wasn't sick. And, I said, look, your blood pressure is 220 over 120. You're carrying a keg around in your belly. I said, you're not only sick, you're going to die. And his response was, well, don't we all have to die? And then I thought, okay, I've got to take a different tack with him. And I said that, if we get you off all these medications, you're spending $880 a month on medications. You wouldn't have to spend that money on medications. And he said, what did he care? The union paid for his medications. So at this point, I realized this is not my normal self-selected, highly motivated, typical TrueNorth Health patient. But I was feeling like, I don't want to strike out on the very first referral from this contract. And so I'm thinking about, what do we know about this guy? What can I do to motivate him? And I realize that one thing we know for sure about, especially males that are on a lot of hypertensive diabetic medications, is they typically have problems with impotence. And so I said, hey, if we get you off all these medications, we may be able to do something about your, little problem. And as he started to stand up, I realized, I'd be in trouble because he's a pretty guy. But what he said was, well, why the hell didn't you just say so? And so anyway, we got his attention. And he was telling me about his diet. And he said he was a triple cheeseburger guy, like the picture here, except that he said if they put any of that lettuce on there, he would take that off and throw it away because he didn't like that rabbit food stuff. In any case, we realized that in order to start him fasting, we couldn't start him coming off triple cheeseburgers. We had to get some real food into him. So we had him take some food from the salad bar and hot bar, and he tried to eat it, but he couldn't actually swallow it. He was like, and I'm thinking, oh my gosh, maybe we missed the fact that he has an esophageal tumor or something because he couldn't seem to swallow the food. I sat down next to him and I asked him what was the problem, and he said that, I said it looked like you were having trouble with the food, and he said, what food? He said that this was not food. He said it was disgusting, tasteless swill, and that if he had to eat tasteless swill like this the rest of his life, he'd rather just die. And he suggested that I go out to his truck and retrieve his 12 gauge, and that when he was not looking, I should just shoot him in the head. Well, we didn't do that, but we did check him in, and he fasted for 26 days, during which time he lost almost 50 pounds and normalized his blood pressure and his blood sugar levels. We got him off his medications, and when we were done, we gave him the same kind of food that we did when he came in, only now he was able to eat the food. And I sat down with him and I said, well, it looks like you're doing better eating the food now. He said, yeah, your damn chef's finally getting the hang of it. It took me 20 minutes to convince him it was the same food. He told me that the disgusting stuff I gave him when he came in was inedible, but this was not bad. And that's essentially what the experience we have is that people, even if you can't get them to eat good foods before fasting, after fasting, good foods taste well. I'd like to spend just a few minutes going through quickly some case reports that we published because I think they highlight the diversity of experiences that we see at TrueNorth using diet and fasting. One was this case of plaque psoriasis. We all know how frustrating that can be. This is before treatment. This is after 2 weeks of fasting. This is on 2-month follow-up, and you can see a progressive improvement. And these conditions continue so long as you can get people willing to do dangerous and radical things like eat well, exercise, and get to bed on time. This was cardiometabolic changes in fasting. Again, this was done with our colleagues at the Mayo Clinic. This was a study where we took healthy people, because we wanted to know, we saw all these changes in sick people, cardiometabolic risk factors. We wanted to know what happened to the cardiometabolic risk factors in healthy people. Well, the first challenge we ran into, it was hard to find healthy people. Most of the people that looked healthy, that weren't symptomatic, when you actually looked at their biomarkers, didn't measure up so well. We did finally found an end for this study. Many of them, it turned out, were people working at TrueNorth eating this whole plant food SOS-free diet. But anyway, we looked and it turned out the magnitude of changes in healthy people, in some cases, was actually greater even than sick people. It may be that the people that get the greatest benefit of all may actually be healthy people looking to stay that way. According to Walter Longo, it published 2015 journal Metabolism, combination of fasting and chemotherapy results in dramatically higher cancer-free survival than chemotherapy alone. It turns out cancer cells become more vulnerable to chemotherapy in the fasting state because they just don't do well in a ketogenic environment. Whereas healthy cells are biologically adapted to it, so they hold up a little bit better. And fasting actually protects healthy cells from the ravages of chemotherapy. And so now they're starting to use fasting in conjunction with conventional therapies to enhance outcome. I believe that I have utilized my available time. Is that correct, Dr. Barnett?
Yeah, we'd love to go to Q&A, but certainly if you've got a few more points.
Why don't we do the Q&A then?
Yeah, so the first question is, does TrueNorth have any experience with people with Lyme disease?
Yeah, it's interesting because we live in a Lyme endemic area. And so our approach to acute Lyme disease is the same as any standard medical approach, which is doxycycline or appropriate antibiotics. But with chronic Lyme, where people either didn't get diagnosed and effectively treated, or they were treated but not effectively, and they develop the whole cascade of symptoms that go on with chronic Lyme disease, water fasting can sometimes be a fabulously helpful interventive tool. It's interesting, we're also seeing a lot of post-COVID, long COVID, and also post-COVID vaccine injured patients that have similar clinical presentations to some of the chronic Lyme patients, and they also seem to be responding very well. In fact, we have a paper we'll be publishing with 40 days fasting with long COVID that was quite revealing. So I don't know exactly what all the mechanisms are, but we do know that as frustrating as chronic Lyme disease can be, at least a significant percentage of those patients do appear to respond to fasting in conjunction with a whole plant food SOS-free diet.
So are you suggesting that they contact you if that's their situation? You would suggest that they contact you if they have that situation?
Yeah, anybody that has a question, they can go to our website at TrueNorthHealth.com, complete the registration forms, and we offer a no-cost phone conversation with me where we can review if there's anything we do that might be relevant, or if we can refer them to somebody that we know that uses these types of methods near them. So, anybody can call and freely talk to me. I'll give them my best advice, depending on what their presentation is.
Right. Okay, Sid. Thank you. What else?
Okay, the next question is, I have begun a whole food plant-based diet, and I'm helping my son learn to eat. He has ulcerative colitis. While I am happy to lose weight, my son needs to gain weight. Should I add oil to his food in small amounts? And my question is, how can I cook for him in a healthy way that helps him gain weight?
So with ulcerative colitis, the most dramatic things that we do is obviously getting rid of dairy and gluten, grains, and sugar, and all that stuff like that. I wouldn't necessarily recommend adding oil to food, but increasing the fat percentage by utilizing whole foods that are rich in fat might have utility. The bigger thing that we do in ulcerative colitis patients is think about, how would you feed an infant? There are some foods that lend themselves to feeding people with very sensitive digestive systems, sweet potatoes, and other starchy vegetable materials. Sometimes we'll process the food more. So instead of whole yams, we might use soup, or we blend it and process it to try to increase caloric density. We may resort to using some vegetable juices and other things that we don't normally use, just to increase reduce the fiber intake and increase the caloric density. So there is manipulation with the food that we do, but it doesn't normally involve using oils or other highly fractionated foods. The other thing we'll do with ulcerative colitis is sometimes use fasting to calm the inflammatory component, and then oftentimes absorption is better post-fasting, and then people are able to gain weight. Also stimulating the system with appropriate anaerobic exercise and other things can also help in our experience with weight gain as well. Getting a little bit going with increased density of the diet.
Yeah, I know some of that was a little hard to hear. You're kind of breaking up there again, Dr. Goldhamer, but let me just I'm just going to jump in here a little bit and help to answer that question. As far as your son needing to gain weight, the real issue is getting his ulcerative colitis under control, right? Which is going to happen when he, assuming switching to a whole food plant-based diet is a significant change from what he's on now. And also would recommend looking into, maybe my wife can type this in the chat, Robin Chutkin. She's a gastroenterologist. I think she's in the DC area now. So maybe, Carol, if you could put that in, that would be great, please. But the thing to do is to remember, fiber is your friend, even though it seems counterintuitive. You really want the fiber because, truthfully, the preferred food of the cells that are lining your gut are what are called short chain fatty acids, and those are produced when bacteria and other members of the microbiome in your gut actually act on fiber. So your colonocytes are going to start getting better when they start to get those short chain fatty acids, and that comes from consuming a lot of fiber.
The challenge can be if you get too much raw fiber with the salad, so it can be a little exciting, and so we have to use more steamed and starchy vegetables rather than the salads and the fruit. The higher sugar that isn't always great, at least initially. Right.
So that's I think we're definitely in agreement on that, and definitely want to get some of the bad things. I make sure there's no dairy and meat and all those other things that are causing leading to inflammation, and that would include oil too.
Dairy is like throwing gasoline on the fire of inflammation. It's just a nightmare when it comes to colitis. It's really the single biggest antagonist as far as I'm concerned. Yeah, exactly. Great. Okay, Sid, what else do you have?
Okay, next, we have a question. At what stage or EGFR numbers would it officially be contraindicated to fast? And is that contraindication only for a multi-week water fast or a few days home water fast as well?
Okay, so obviously there's some variation depending on the individual, but if BMR is below 16, we're not normally going to be looking at fasting, and between 16 and 18, you're going to be looking at a relatively short duration, but it depends on the reserves of the individual that you're dealing with, and sometimes you won't know how long to fast until you see how they hold up the fasting. Fasting itself can be as much diagnostic as therapeutic.
So I'm sorry,
multiple short fasts.
Just to clarify, we were talking about chronic kidney disease patients, correct, Sid?
Yes.
I missed that.
Okay.
So you're asking not about. I misunderstood what you were saying. So you're talking about if creatinine levels are over 2.0, generally we would defer fasting until creatinine levels were below 2.0 as a general rule. GFR, again, depending on what the history is and how they respond. Some people's GFR will actually increase with fasting instead of decrease if active inflammation is an issue. So chronic kidney disease is a very serious problem, though, and it is a relative contraindication to fasting if the kidney disease is sufficient, or if it progresses, if creatinine goes up too much during fasting, then we would move into a different type of intervention.
Right.
So
okay.
It's really important that you don't take a person with progressive deteriorating kidneys, put them on a water fast, and then shut down their kidneys. That would be a really serious problem.
Right.
But now I thought we were talking about BMI, that if BMI was too low, if the person didn't have adequate reserves, then we would, also have to modify what we're doing, because you have to have adequate reserves in order to adapt to the fasting state.
Right. Okay, Sid, what else do we have?
Okay. Is a whole food plant-based detox good to do with real food? For example, week 1, you would have a chewable meal, then liquids. The second week, liquid only. The third week, water only, and then reverse. Is that safe to do?
Well, we recommend that everybody, before undergoing fasting, have a carefully controlled whole plant food, SOS-free diet. And you want to have that long enough so that the adaptation of fasting is reduced, and it's much easier, that their bowel function is normalized as much as possible. So, absolutely doing an appropriate lead-in is a critical issue. And I have to say, many of the patients that we get calling us work with our doctors through our telemedicine practice. And so many times, by the time it's time for them to come in, they're already better. Just making the dietary and lifestyle changes is sufficient to reverse the pathology in many people. In some patients, despite good diet and lifestyle, there are problems that are persistent enough that fasting can be a great catalyst. But I've had many people that no longer qualify for the studies they're enrolling in, because by the time they've come in, they've already gotten so well that, it messes up the whole thing. And, these doctors that work for us can't help it, because that's just how their personality is. So I don't get mad at them.
Right. Okay, Sid.
We have chiropractors that we have at TrueNorth often say, you have to rush in and try to treat people right away, because if you wait till they're done fasting, there's not going to be anything left to have to treat. Because so much inflammation is causing so much of these problems. And fasting gets rid of the inflammation, as does the diet, but a little bit slower. And if you reduce the inflammation, you reduce the problem. We talked earlier about the visceral fat producing these inflammatory products that's causing these problems. If you control diet, sleep, and exercise, you control the problem. Fasting can be a facilitator. It can make things happen quicker. But it always comes back to diet, sleep, exercise as driving health.
So, Sid, I think we have time for one more question. It's a little after 8 o'clock.
All right. What kind of IV therapies are common on extended fasts, and for whom would those IV therapies provide the best or direct or complementary support while they're fasting?
We don't use any intravenous feed during fasting. So if a person requires intravenous feed, it's usually because there's been electrolyte imbalance. We would terminate the fast. And almost always we can do this orally. We don't have to resort to intravenous feed. But we would, if you got into especially if you're having complications with diabetics or colitis patients that get into dehydration issues, intravenous feeding could become an issue. It's normally literally a bag or two, short-lived, not an issue. But it's also very rare. Less than 1 patient per 1,000 do we have to resort to intravenous feeding. So we don't do it. We don't do nutritional medicine type intravenous feeding during.
Well, thank you so much, Dr. Goldhamer. And on behalf of, and thank you, Sid, by the way, and thank you to our engineer tonight, Bob Frankie. And on behalf of the Plant-Based Nutrition Support Group and Rochester Lifestyle Medicine Institute, I thank you, and I thank our audience. So everybody have a wonderful evening. If you want to get a recording, please send us a message, and we will get you a recording of this in a few days. All right. Good night, everybody.
Good night.